Concerns about rising COVID-19 cases. There's also hope on the vaccine front. Joining us now live is Dr. Rob Danoff, director of the Jefferson Health Northeast COVID Testing Center. Good morning, Dr. Rob.
Morning. How are you?
Doing well, sir. Well, health officials will be watching for any potential surges in cases following the Thanksgiving holiday. If someone traveled or got together with family or friends, what are you recommending at this point?
You know, right now we're recommending, if you can, to quarantine. Just assume that you've been exposed because this virus is so easily transmitted. So what we're recommending right now is really try to socially distance. Do your best if you've traveled, no matter where you were, the airport, if you're in the waiting areas with different family members from different areas of the country. It's going to take, normally people, if they're going to get symptoms, it's usually on day 5 or day 6 from exposure, but the range is 3 to 14 days. That's why we have that 14-day quarantine. If you live at home with someone 65 and above, please wear a face covering at your home and try to distance from them. Now, there are a lot of people without symptoms who don't really show anything, about 40%. So a lot of us are recommending about 5 days after you come back, you wait at least 5 days, perhaps consider getting a COVID test to see where you're at. But certainly, if you have any symptoms at all, Jim, you want to just quarantine until you get a test.
But if you get that test too soon, you may get a false negative, correct?
Jim, that's a fantastic point. Okay, if you were exposed to somebody, you don't call up and say, okay, I need a test today. We need to wait at least 5 days from your exposure before we get a test if you don't have any symptoms. If we get it too early, it's going to be a false negative. Okay. So the timeline is 5 to 7 days after your exposure. If you don't have symptoms, that's when you go get a test. So now, you quarantine until then.
So now Moderna filed on Monday to allow for emergency use authorization of its coronavirus vaccine. What are the next steps that we should be prepared for?
Yeah, the Advisory Committee of Immunization Practices is meeting today in the afternoon. What they are doing is trying to prioritize groups to receive these vaccines, 1A, 1B, 1C. So the initial group may be those perhaps the seniors or long-term care facilities, healthcare providers, which will include housekeepers who are taking care and cleaning the rooms. They're at high exposure, nurses, respiratory therapists, and then they're going to go down the line with people at most at risk, first responders. So they're making that recommendation. The reason why they moved up the meeting today is because the governors of all the states need to have their plans in by this Friday. So they're hoping the guidance presented by the Advisory Committee today is going to coincide or help the governors make their decisions. So our governors in New Jersey and Pennsylvania will be making the decisions who gets the vaccines and when. And as far as timeline, Jim, the FDA is meeting on December 10th for the Pfizer vaccine. We expect a quick approval. Once the advisory panel recommends something, within 24 to 48 hours, we expect that will be approved. The Moderna vaccine is being reviewed December 17th. So realistically, everyone, there's probably going to be about 40 million doses available by the end of December, which is enough for 20 million people. And
we have a lot of major chain pharmacies that are already on board as far as the distribution, correct?
Jim, that's a great point. CVS and Walgreens have been, the Pfizer vaccine needs to be stored at minus 94 degrees Fahrenheit. They have been preparing for this, so the government has contracted with them. So initially, they may be the locations, select ones, that are going to start giving these vaccinations. So stay tuned for more, but that's kind of the latest what's going on right now. So the government has been, providing and planning for this. So we expect a rapid turnout. But realistically, Jim, for all of us, there's going to be maybe enough doses in December for 25 million people, which is 50 million doses. Each person gets 2 doses. And each month thereafter, at least enough for 25 million people as they ramp up.
With, the holidays, we got more holidays just around the corner here. What are your concerns? If we don't get this surge right now after Thanksgiving, what about going into Christmas?
Yeah, so Jim, we are expecting the surge. Believe it or not, we're starting to see it. People who traveled and came back on Friday. We're seeing it at our testing centers. Our testing centers are crowded. Realistically, and this is not to scare anybody, but our hospitals are getting full. And so we expect, as Dr. Fauci said, this is a surge upon a surge. So the travel is going to continue. And it's hard for all of us, everyone. It's so hard. We want to be with our loved ones, but we're really asking, stay within your own select small family group through the holidays because this is so easily transmitted. There is a light in the horizon. It's going to come, but right now we still need to kind of socially isolate, keep within a small group. Please, everyone, wear face coverings cover your nose too. It's really important.
Good advice as always, Dr. Rob. We appreciate it. We'll be checking in with you in the upcoming days, but in the meantime, stay healthy and safe.
Be safe.